Hi everybody, it's Dr. Sam Price. I am waiting for you guys to come into the chat room. We are going to do the naturopathic therapies for cancer care today. So we've been doing a series, and the series is all about cancer care and naturopathic cancer care. So I'm going to wait for you guys to come on in. I've got plenty of notes for you guys today. I thought that I would go over the conventional and the alternatives. So I'll wait for you guys to come on in. Come on in. Hi, whoever just joined, can you type in there? Let me know who it is. I don't ever know who it is unless you guys type into the chat room. While I'm talking, if you guys have questions, just put them in the chat, and then when I finish, I will go back over them and I will answer all of your questions, okay? So we will get started. I see we have 2 people on already, so just type in the chat. Let me know that you're here, please. I'm Dr. Sam Price. I am your licensed naturopathic physician. I am an expert in natural medicine. I help you bridge conventional and alternative medicine to transform your illness into wellness. Today we are talking about naturopathic cancer care, specifically naturopathic therapies. So the last couple of weeks we've talked about naturopathic causes, why we think that cancer comes around in the first place. What are some of the testing that we like to do as far as naturopathic testing? This week is all about the naturopathic therapies, but of course I would be remiss not to mention the conventional therapies as well. Okay, so I thought I would just go over those really quickly, hopefully, with you guys. There are 6 that I kind of pulled out. Of course, there are more. I pulled out 6 conventional therapies, and I pulled out 7 naturopathic therapies, and of course, there are more of those as well. These are the ones that I feel like are the top, that most people are familiar with, that are most widely used. Okay. So I'll give you the 6 and then I'm going to talk about them. Then I'll give you the 7 and I'll talk about those. So the 6 conventional ones that I pulled out are chemotherapy, targeted therapy, radiation, surgery, hormone, and vaccine therapy. Okay, so let's talk about that. So chemotherapy basically are a wide array of drugs, so different types of chemotherapeutic agents that are usually man-made. Some are plant-based, but most of them are man-made or synthetic. You can usually get them IV, some of them are pill form. These interfere with cell division, and what they're trying to do is they're trying to actually cure the cancer or kill the cancer. Some of it's sometimes used to prolong life or increase the quality of life. So the problem with most chemotherapies is that they're great at destroying the cells during cell division, but they're destroying all the cells, including the healthy and the normal cells. So it's basically just depleting your immune system, totally wiping it out, and that's what causes the side effects, okay? So that's chemotherapy in a nutshell, very basic. Number 2 is targeted therapy. This identifies your specific cancer cell. We call them oncogenes, and it's definitely like a chemotherapy, but definitely less invasive. Still has side effects, okay? Radiation is where they are using high energy waves directed at the tumor specifically, usually to shrink it. It disrupts cell division and the tumor dies. It's much better therapy if it's like a carcinoma or rapidly dividing type of cancer, because it's targeting cell division. And if the cell's not dividing, then the radiation doesn't actually get it. So the problem with radiation is that a lot of times these cancers come back, even though they might come back and they're more slowly growing than before. Their radiation is usually followed up with chemotherapy or surgery. So they'll do radiation and then they'll say, oh, the tumor shrunk. Now we're going to go into surgery and take it out, and then we're going to do chemotherapy. So that's radiation in a nutshell. So number 4 would be surgery, where they're cutting out the tumor if it's large enough, or if it's in a place that's viable for them to actually go in and do surgery. They'll cut it out, and what they're looking for is what's called clean margins, is that they got all of it. But most of the time in surgery, they follow it up with chemotherapy or radiation. So the 5th one is hormone. are hormone therapy. So this uses hormone disruptors to arrest or slow down the growth of a tumor. Usually, so we think of that breast, prostate, ovarian, anything that has to do with hormonally related cancers. So tamoxifen, which most people are familiar with that drug, this falls into that realm of a conventional therapy for cancer. Number 6 is vaccine therapy, and I was kind of debating on whether or not to put this in conventional or to put it in naturopathic. So it is kind of new. It's called also immunotherapy, and it's so super new that in fact there was a study that just came out August 2017 about some of the immunotherapy or vaccine therapies. It increases the immune system, so that's pretty good, right? There's 3 that I know of that they have. There's glioma, melanoma, and prostate vaccines right now. And this is totally different, guys, from the vaccines that prevent cancer, like Gardasil for HPV or cervical cancer. I'm totally not okay with those. I disapprove of those. That's a whole nother tangent that we can go off on. So Russia actually has a wonderful vaccine for cancer that is funded by their government. It's more, I don't know whether or not to call this a vaccine though, because it's kind of homeopathic. So they take the cancer from the patient's blood and then they run it and they actually dilute it and they succuss it, and it's made into what we call homeopathy, and then they re-inject it. So the patient's body is actually mounting an immune response to their own cancer. So they call it, it's called Rigvar, and it's only in Russia. It's a very little part of Russia called Rig, and they've named it Rigvar for the vaccine. So it actually is doing really, really well. Of course, we don't have it over here. Okay, so those are the 6 conventional therapies. So I'll go over them again. There's chemo, there's targeted therapy, there's radiation, there's surgery, there's hormone, and then there is vaccine therapy. So what you guys came for today is to talk about the naturopathic therapies. So there are 7. So let me list them out for you, and then I will actually go into them a little bit more. So treatment is always, as I said in the very first video, is about what is the cause of cancer? What is the cause of chronic disease? And in my naturopathic brain, there's 3. There's 3 causes. That's it. Okay? Number 1, if you're on here, type it in the chat for me. Number 1 is the abnormal composition of blood and lymph. The abnormal composition of blood and lymph. Number 2 is decreased vitality or a decreased vital force, or in the conventional world, it is called a decreased immune system. Number 3 is toxemia. That is the buildup of morbid matter or waste. So toxemia, the buildup of morbid matter or waste. Okay, so in knowing that these are the 3 reasons that cancer could possibly be happening, right? All my treatments, anything that I think of, is always trying to target this. How do I build up the blood and the lymph? How do I balance it? How do I build up the immune system or the vital force? How do I decrease or get rid of the toxemia? How do I detox it? Okay? So in knowing that, there's 7 different ways that I've pulled out today to talk to you about doing that. Okay, so I'll list them out. So diet, 1. 2, emotional detox. 3, supplements. 4, homeopathy. 5, IV vitamin C. 6 is mistletoe, and 7 is hydrotherapy. Okay, there's a lot. I'm sure I've missed some, like sleep and hydration and those type of things, but these are the 7 that I've pulled out for you today. So let's get started. Number 1 is diet. All right, so there's 2 different ways that I do diet. So we all know that I absolutely am in love with the blood type diet or the genotype diet. The fact that you can actually use your blood type to know which foods are going to be toxic for you and which foods are going to be medicinal for you. The Carroll method for food intolerance actually shows us which foods we do not digest or metabolize well. If we're not digesting or metabolizing the foods well, then they're sitting in our body and they're becoming rancid, and this causes toxic buildup, toxemia, right? So we have to know which foods are doing that so that we can avoid them. Blood type diet is nice because we know which foods are actually helping us or increasing our ability to do our daily functions. They actually work as medicine for us. So when we combine these two, we actually know what foods are working as medicine, and we also know which foods are acting as poison in our body. So that's why I like that. So it works on all three of my causes. It balances blood and lymph, it decreases toxemia, and it increases the vital force. Okay, so that's diet number 1. Number 2 is emotional detox, and we know that I just recently did a video on emotional detox, so you can go back and look at that. A lot of times emotional things like stress or sadness or grief or depression or something like that actually works on a physical level. It actually gives us physical symptoms. So even though stress in the literature can't be linked to cancer, stress is linked to a decreased immune system, which then in turn does cause cancer. Okay, so I think that emotional detox works on toxemia. Okay, so we can do detox by emotional detoxing, and it also works to increase the vital force. All right, so number 3 is supplements, and there is an exhaustive list of supplements, but for this video, I'm going to share the ones that have in vitro and in vivo, which means animal studies and human clinical trials that have been proven to, yes, be good for cancer, to help eradicate cancer or to help decrease cancer. Okay, so berries are OPCs, pineapple, which the active constituent is bromelain, curcumin or turmeric, that's in the literature and you've heard a lot about that here lately. EGCG or green tea, that's the active constituent in green tea. This actually helps to stop the start codon of a cancer cell. So most of my patients are on 3 to 4 cups of green tea a day. There is a type of green tea that you need to drink, so please know that. Lycopene, which is tomatoes. Not everybody can have tomatoes. It depends upon your diet. Phytoestrogens, so soy. So contrary to your popular belief, soy is very good for cancer, and it is in the literature. Pycnogenol, which is pine trees. I'm going to talk about that when I talk about mistletoe. Resveratrol, which are grapes. So everybody's like, oh, can I have wine? Yes, sometimes it is good for cancer. And selenium, so nuts. This is really great for prostate cancer. So yes, there are plenty more supplements. My patients know that there are plenty more supplements. Not a lot of time to go into all the supplements. There are a medicinal cabinet full of things that you can use, but we kind of need to know your story, your history, your cause, your cancer. So everything is very customized when I do cancer care for my patients, okay? So that's supplements. So let's go into number 4, which is homeopathy. Very difficult to explain homeopathy, but it's a specific way of giving you a supplement that is so customized for you on an energetic level to deal with your mind, your body, and your spirit. What I wanted you guys to know about homeopathy today is that there are research studies out there that talk about homeopathy and cancer and having success. Specifically, there are quite a few that are with breast cancer. You need to find somebody who's versed in homeopathy and that can take your case really well. And then, of course, there are other things that you need to do with the homeopathy as well. So number 5 is IV vitamin C. So this is high dose ascorbic acid placed into the vein, okay? So a couple of things that I need for you guys to know. So everybody asks me, well, can I just take a high amount of oral vitamin C? Well, yes, you can, and I do have my patients do that in between IVs. However, the oral dose is more of an antioxidant, which is great. When you're taking IV vitamin C, it acts as a pro-oxidant, okay? A pro-oxidant is different from an antioxidant. So a pro-oxidant actually produces hydrogen peroxide, and it's going to target neoplastic cells while leaving the healthy cells unharmed. So you know how I told you that the chemotherapy is going to target the cancer cell, but it kind of targets everything. The IV vitamin C actually goes in, it targets the neoplastic cell. It does not target the healthy cells. So it's really great as a cancer adjuvant. Usually when people are sitting in the office, it takes anywhere from 45 minutes to an hour and a half. I've had people drip for about 3 hours, depends upon your vein quality. I like to do it 2 times a week. I've had people in here 3 times a week, once a week, 2 or 3 times a month. 2 times a week is really beneficial if you can do it. There are some contraindications that I wanted to go over. So we always test G6PD. This is a deficiency of your red blood cells and how you make them. So if this is abnormal, we will not do IV vitamin C on you. Hi there, Tina. Nice to have you. We also do, yes, it is the happy juice. We also will not do it if you're doing a methotrexate type of chemotherapy. So IV vitamin C, yes, can be used while you're doing chemotherapy and radiation. In fact, it should be done on the same day that you're doing chemotherapy and radiation. The only contraindications are if you have an abnormal G6PD and if you're doing a methotrexate type of chemotherapy. I think that was all I wanted to say on IV vitamin C. So this works on all 3. It's going to help to change the composition of your blood and your lymph. It increases your immune system, and it also actually helps to decrease toxemia. Okay, so that was number 5. So I'm going over notes. So number 6 is mistletoe. So mistletoe is one of my favorites, guys. So let me take a second to actually tell you guys about mistletoe. So one of the cool things about mistletoe, when you actually look at the plant of mistletoe, it has the doctrine of signatures is what we call it. So doctrine of signatures is where you go out and you see like a plant that looks like a kidney bean or a kidney. It actually means that that plant is good for the kidneys, okay? Or if you see a plant that looks like the shape of a heart, it is probably good for the heart. It's called the doctrine of signatures, okay? So when you go out in nature and you look at a mistletoe plant, it looks like a tumor cell, all right? It actually grows from the outside in. It's not on the tree itself. It's not on the bark. It's not on the branch. It's like it just pops up. It also does its blooming or its berries happen in the wintertime. It's so odd. It doesn't play well with others, and it's disruptive, exactly like what I said last week when I talked about how does the tumor cell react. It doesn't stay in one place. It doesn't replicate the way it's supposed to. It's just an abnormal cell, right? So when you look at it in nature, it's an abnormal growth. It's just kind of there, right? So I wanted to tell you guys about that. So it works on the abnormal composition of the blood and the lymph. It increases the immune system. It works on all 3 of my causes, okay? So this is the most well-studied, integrative, I call it naturopathic cancer treatment in the world. There are over 7,000 studies on this therapy. It works, guys. All right, so it actually penetrates the cell, and it is viscotoxic and cytotoxic. And what I mean by that is it actually works to penetrate the cancer cell, kill the cancer cell without disrupting any of your normal or your healthy tissue. Okay, so if you live in Germany, Sweden, or France, it's 85% that you will get this along with your conventional care. Yes, 85% in other parts of the world, and 75% in all the other European countries, okay? So let me explain. So part of the reason why they use it in their conventional treatment is because it decreases the side effects. Here are the side effects that it decreases, and think about this for those of you guys who are on here who have gone through conventional treatment like chemotherapy, radiation, and surgery. Think about the side effects that you had, and think about what I'm telling you, that mistletoe actually decreases the side effects or makes you not have these side effects. Not only does it decrease the side effects, it's actually working to kill the cancer cells, and it's actually working to work in conjunction with the chemotherapy or the radiation to make it more effective. So here's the list. It reduces anemia, neutropenia, thrombocytopenia, hepatotoxicity, that's liver stuff, nausea and vomiting, pain, ascites, that's that swelling that you get. It increases the survival rates and it improves the quality of life. So this is why I love mistletoe, okay guys? There's 5 different types. I use 3, okay? The 3 types that I use are M, which is the apple type, A, which is the fir type, and P, which is the pine type. So that goes back to the research studies on pine tree, okay? The 2 others, I don't use them, so we're not gonna talk about them. So normally, when we're doing mistletoe, most of the protocols are you're going to inject yourself in the abdomen, the upper arm, or the thigh 3 times a week. Some protocols are different. It's usually a stair-step system where you're graduating up to an increased dose depending upon your reaction. There's usually really no side effects, guys, which is why I love it. It is contraindicated in some things. So, fever, tuberculosis, pregnancy, breastfeeding, and biliary stenosis. Those are the contraindications, all right? Don't try this at home. Don't try this by yourself. Get somebody who's versed in doing mistletoe therapy. Don't do it yourself because you could get a cytotoxic reaction, so usually there's no side effects. But there could be some little issues that go on if you're not doing it properly, okay? All right, so that was number 6 on my list. Number 7 is hydrotherapy. I love hydrotherapy. So hydrotherapy is the alternating of hot and cold water with or without a sine wave machine. So when we're doing it with a sine wave machine, it's like a bigger bang for your buck. It's actually going to concentrate the therapy better. Okay, there was a B somewhere. You can do this in the office or you can do it at home. I usually like for my patients who are doing it in the office to also go home and do it. If you're going to get it done in the office, please make sure that the person has been trained properly on constitutional hydrotherapy and that they know what they're doing. It actually increases peristalsis, which is bowel movements. It makes your gut move and it makes you get rid of all of the toxins. So this works great for toxemia, right? Decreasing the morbid matter in the waste. It also increases the immune system by increasing circulation. So we're increasing the vital force, or the V's. And we're also changing the composition of blood and lymph by increasing the red blood cells and the white blood cells. So a fantastic therapy for cancer care. All right, so let me go over the naturopathic treatments that I just gave you guys. So basically the whole goal of the treatment is to balance blood and lymph, increase the vital force or the immune system, the body's inherent ability to heal itself, and to decrease toxemia, or just to detox the body of all the morbid matter and waste, whether that's emotional or physical. Woo, that was a B. Sorry guys. All right, so here's how we do it. All right, number 1 is diet. I like blood type and Carroll method for food intolerance. 2 is emotional detox. 3 is supplements. 4, homeopathy. 5 is IV vitamin C. 6 is mistletoe, and 7 is hydrotherapy. All right, that is naturopathic cancer treatments, guys. I don't see any questions. If you guys have any questions, hurry, hurry, hurry and type them and I will answer them. Thanks so much for joining. I thank you so much for being here. Oh, great job, Ashley. Thanks for typing them in there. I appreciate that. If you guys have any questions, I can answer them for you. Actually, I think what I'll do is I'll take a picture of what a mistletoe looks like and I'll put it in the chat so that you guys can see what I'm talking about, because it's a pretty interesting little plant. It only flowers in the winter time, so the berries are in the winter time. And yes, I'm talking about the mistletoe that you hang over the door sill and that you kiss somebody under. So it's a pretty cool little plant. So all right, guys, if there are no questions, I'm Dr. Samm Price. I am your licensed naturopathic physician. I'm your expert in natural medicine. I help you bridge conventional and alternative medicine to transform your illness into wellness. Thanks so much for joining me. Follow me on all social media at Dr. Samm ND. That's DrSammND. N as in naturopathic, D as in doctor. If you go to my website, you can get a free little pamphlet. It's www.drsammnd.com. That's DRSAMM, N as in naturopathic, D as in doctor.com. Have a great day, guys. Bye.